Why this difference matters. Understanding the difference between NDIS positive behaviour therapy and positive behaviour support helps you choose support that truly fits your life, not just your plan. It affects who delivers the support. It changes which NDIS budget is used. It shapes what support looks like day to day. It helps avoid confusion or unused funding. NDIS positive behaviour support. Positive behaviour support focuses on understanding behaviour and reducing distress in a safe and respectful manner. Supports people living with disabilities with behaviours of concern. Delivered by an NDIS behaviour support practitioner. Involves a behaviour support plan. Focuses on safety, dignity and quality of life. NDIS positive behaviour therapy. Positive behaviour therapy builds skills and coping strategies through regular therapy sessions. It supports people living with disability to better understand emotions, responses, and everyday challenges in a safe, supportive space. Often delivered by a psychologist or therapist, focuses on emotions, communication, and behaviour patterns. Usually one-on-one sessions, may not include a formal behaviour support plan, PBS versus positive behaviour therapy. Both supports help people thrive, but they do different things depending on needs and goals. Here are a few differences. PBS focuses on safety, systems, and behaviours of concern. Behaviour therapy focuses on skills, emotions, and coping. PBS often includes formal plans and carer or support worker training. Therapy is usually session-based and individual. PBS is commonly used when behaviour impacts safety or stability. Behaviour therapy suits lower-risk challenges and everyday skill building. How NDIS funds behaviour support and therapy. NDIS funding categories matter more than many people realise. PBS is usually funded under Improved Relationships Behaviour Therapy, often sits under Improved Daily Living Plan. Wording affects what you can use. Support coordinators can help clarify budgets. Positive behaviour support looks at the whole system. Positive behaviour therapy focuses on individual skills. Which option is right for you or your child? The right support depends on what's happening in everyday life. PBS may suit higher risk or complex behaviours that affect safety, routines, or stability. Positive behaviour therapy may suit emotional regulation, coping skills, and day-to-day behaviour challenges. Some people benefit from using both supports together, each addressing different needs. Needs can change over time and supports should be reviewed. What does PBS look like day to day? Positive behaviour. Support, PBS, is practical, everyday support designed to reduce distress and make daily life feel safer, calmer and more predictable. Understanding triggers, routines and what behaviour may be communicating. Creating a clear, person-centred behaviour support plan. Supporting families, carers and support workers with consistent strategies, reviewing and adjusting supports as needs, environments and goals change. Positive behaviour therapy sessions day to day. Positive behaviour therapy focuses on building skills and coping strategies through supportive one-on-one sessions. Sessions may include talking, play-based or visual activities, emotional regulation and coping skills, problem-solving and flexible thinking, communication and social skill development. How effective care supports you. At Effective Care, we listen first and guide gently, so support feels calm, respectful and centred around you. We help you understand the difference between PBS and positive behaviour therapy. We explain NDIS funding options in clear, plain language. We work alongside families, carers and support teams for consistency. We prioritise dignity, emotional safety, choice and long-term well-being. Next steps. If you're unsure about the support, you don't need to have everything worked out before taking the next step. Take a moment to reflect on your main goals and concerns. Check your NDIS plan, wording and available budgets. Talk things through with your GP or support coordinator. Seek calm, no-pressure guidance when you're ready. If you'd like support to talk through your options, Effective Care is here to help you explore what may feel right at your pace.